I'm Jim Carnicella from the City of Ocoee, Florida. I'm the Human Resource Director. My purpose for coming to the Wellness Conference was twofold. First of all, to learn what other jurisdictions and other employers across the country are doing about the wellness issue and how to impact wellness into the employees and into the organization. And secondarily, I was also asked to share our experiences in Ocoee, Florida, about the on-site health center that we opened 18 months ago and how that has impacted the wellness of our group. I've been a human resource director for 25 years. We've been dabbling in and experimenting on different strategies to implement wellness programs. The problems seem to be that the lack of participation eventually by the employees and their dependents into those programs have been less than satisfactory over all those years. Well, corporate health wellness to me is an effort to impact the long-term wellness of the entire group of employees that work for a particular employer. Corporate wellness it seems to be something that is always a moving target about what strategy may work to get the employees to participate in efforts to cause them to take care of themselves, to deal with whatever issues they may have from a medical or psychological or behavioral perspective. And it's just sort of it's a word that I use that would be a comprehensive way of making the employees more productive and to be able to deal with whatever physical and other related issues they might have. The more healthy the workforce is, obviously it impacts the costs of providing health care and other issues that are real important to the employer and to the employee in reducing those costs long term. And secondarily, the production and the morale that the employee then brings to the workforce is probably more important than anything, and that is if an employee is physically, mentally, and emotionally stable and not suffering in a long-term way, they're going to be so much more productive, which actually reduces the cost of doing business because if the employee is much more productive and reaches the levels of expectation that you'd hope for, in our case, you wouldn't have to hire more folks to do the same type of work. Well, the statistics over the years have shown that Americans are becoming morbidly obese at an alarming rate, and now 60% of the employees are considered obese. So that alone is one example of what's driving the costs of healthcare in the United States, along with all the other related issues of illness. Wellness then becomes this wellness idea, and getting the employees to react to all of the things that can cause them to reverse that kind of trend is really what is at the heart of what we're trying to attack. I've been trying for 25 years to effectuate wellness programs and implement different strategies. None of them have ever been effective, and what I mean by that is that we might impact 5 or 10% of the organization for a very short period of time. I believe that what we've done with opening an on-site health center to attack the primary care issues has allowed us to develop a database of and a snapshot of what our workforce looks like from a wellness perspective. And because of the type of services that we're providing at the health center, we're able to customize a wellness program on an individual basis with someone who a medical professional, by the way, a physician and registered nurses, who are now turning out to be the coach and the coordinator of that care, especially if the care includes specialty type problems, and that those medical professionals are bridging the gap that has been created between trying to implement a strategy and having a person, an employee who is fearful of all that and avoiding all of the good outcomes that could occur because of it. It's funny, the strategies weren't wrong or weren't bad. It was just that there was this gap between the strategy and the effectiveness of the of that particular strategy. And I think what we've found is that using the on-site medical center as a conduit, it's bridged that gap, and now we're seeing a dramatic change in the way the employees take care of themselves. Well, corporate wellness, the industry, this is the first time in a long time, after going to conferences for years and years and trying to stay up on what is happening with wellness in general, this type of bringing together professionals from across the country and talking about different strategies. It's the first time that I've really been involved with an association that has attracted a number of folks who are involved with either A, providing services, or B, questioning what has happened to us in the future and how can we effectuate the kind of change that needs to occur in order for these strategies to be effective. So I think finally, after all these years, we've realized that nickel-diming this issue hasn't worked, and that you need a more comprehensive approach to the issue of and to the idea of wellness. And I'm excited over the fact that after all these years, it seems like we've realized that what we've been doing isn't working very well, and that now there's a whole lot of people that have come up with different strategies that if you overlap all these things and overlay one strategy with another, we may actually be fairly successful. The conference is amazing. I'm humbled to have been asked, first of all, to come and share our experiences, only because coming from the public sector, it's something that when you talk to corporate folks and you talk to private sector folks that have 10 and 20,000 and 80,000 employees, with the resources they have, versus a public sector agency where we're dealing with tax dollars and taxpayers, but we all have the same problems and we all face the same issues, even though we're a much smaller organization. I'm humbled by the experience, but I'm excited about the fact that there's so many people here sharing ideas, and I believe that, like I said, this is one of the very first times that I think I've been with a group of folks, a large group of folks who are interested in one another and what's happening to us, and this sharing of ideas is amazing. This is a wonderful conference. Having an association like this and coming to this meeting, and I don't know how many times this has come together, but it's obvious that when the word gets out that this association has attracted the kind of folks to come and make presentations and to come and have panel discussions about what we've done and what we can do better in the future and what's available out there, is that like many of the associations I've belonged to over my lifetime, that if it's done like this one has been done, it's going to be very important for my colleagues to become aware of this association.